Hey, what's up? Dr. Taylor, Aspire Chiropractic. I don't get pissed off easily. I don't get mad easily. I want to talk to you about something today that got me real pissed off. So let's do a little backstory here. We do something in the office called decompression. Decomp for short, if you're making a video and don't want to have dead air. We do decompression here at the office. What is decompression? Decompression is great for a few things, namely disc issues. So some quick anatomy. We've got the base of our skull here. We've got our spine here. Your spine is made up by 24 individual movable bones. You've got 7 in the neck, you've got 12 in the mid-back, and you've got 5 in the low back. Now, between each one of those bones is a disc. And a disc, again, a little anatomy here. So if we've got a bone and a bone, the disc lies between them, and the disc is nothing more than a jelly donut, okay? Just like that. It's got, if we take this here, we're looking from the side. Now we're going to look at it from the top. It's got a fibrous outer ring, and then it's got jelly on the inside. So I'm a chiropractor. I work with spines. What do you think I see a lot of? Herniations, bulging discs, hot low back. Why? Because there's been some insult or some injury to the disc or to the joint that causes the jelly on the inside to start to move to the outside. When it moves to the outside into the disc itself, it causes a bulge. When that jelly gets from the inside of the disc, outside of the disc in total, that's a herniation. So you have a disc bulge or a herniation. This is where decompression comes in. So how do we get that bulge or herniation to retract back into itself? Naturally, stretch the spine. It's incredibly simple. It's physics, okay? If we've got solids here and we've got liquids in here, if we stretch the spine vertically or along this axis, we increase the space between these bones. That causes a negative pressure to suck that disc material back into where it belongs. Herniation goes away. Cool, okay, sounds awesome. Doc, is there a way that you can speed that up? Yes, 100%. So, decompression, we're working on the discs and the joints of the spine. Each one of these discs has a movable vertebra above it and below it, and then they've got nerves that come out right next to it. This is why disc bulges hurt, right? So if you've got a disc here and it's bulging out and it's pressing, if we've got our spinal cord here, remember we're looking from the top down, and the nerves go out like that. If we've got that bulge, here, draw it over on this side here, if we've got that bulge exiting and pressing on that nerve, that's where that pain comes in. So if we can reduce that disc bulge, we reduce the pressure on the nerve, it goes away. So can we do that with decompression? Absolutely. Can we do it faster by doing other stuff? Absolutely. So patient comes in, they're complaining of, let's say, sciatica, or they've got x-ray evidence, they've got MRI evidence of a disc bulge. So what are we going to do? We're going to do decompression. We're going to create a negative pressure system to suck that bulge back in, get the pressure off the nerve. Perfect. What else? I'm a chiropractor. What am I going to do? I'm going to adjust you. Why? Because what's above and below the disc? The bone. If the bone isn't moving, the disc is going to die, generally speaking. It's going to degenerate. So if we've got a bone here, we're looking from behind now, and we've got a bone here, and then we've got the disc between it, and we're trying to reduce a disc bulge. We're doing the decompression to stretch that out, to suck that in. But if this bone isn't moving properly, or this bone isn't moving properly, we get nutrients into the disc, and we get bad stuff out of the disc through movement, okay? Meaning these bones have to move. This thing acts like a sponge. So if this bone is subluxated, not moving, if this bone is subluxated, not moving, God forbid if they're both subluxated and not moving, you know what they're not doing? They're not squeezing that disc. So you can do all of the pulling you want, all of the decompression you want, stretching out that whole thing. But if you're not addressing the bones above and below the disc where the problem is, you're wasting your time by not doing the adjustment, because you're not looking at the whole complex. You're not looking at the whole person. Everyone who comes in here, whether it's a neck pain, a mid-back pain, a low back pain, a knee, an ankle, a wrist, everyone gets their entire spine checked, all 24 bones. And regardless of what issue they're coming in with, provided they are able to be adjusted, they get adjusted, even if they're doing decompression. They get adjusted, even if they're doing soft wave because we're working on a meniscus thing on a knee. They get adjusted. If they're coming in with a disc issue, a spinal issue in the soft tissues of the disc, you bet your ass they're getting adjusted. We're moving bones because we're going to use everything we have in this office to make you as good as we can get you, as fast as we can get you there. Now, the reason I tell you all this, I had somebody come in, they came from another chiropractor, and they did decompression only. All they did was they went to their office, they laid on their back, they pulled on them for, I don't know, 10, 15, 20, 30, I don't even know how long it was. They pulled on them, and then they stood up and they walked out of the office. They never got adjusted. They never actually got their spine checked at a chiropractor. So, chiropractor, we move bones. We address subluxations of the spine. We address dysfunction and disease in the spine, causing dysfunction and disease in the body. Now, if you've got other things around there that are amplifying this dysfunction disease, we'll address those too. But you can bet damn sure we're also going to address your spine and you're going to get adjusted. This person that just went to this chiropractor and just did decompression was given a tremendous disservice because the doctor didn't do everything that they had in their power and at their disposal to get them as good as they could get them, as fast as they could get them there. They had a machine they wanted to sell packages for. So, do we do decompression in the office? Yes, and we do it with adjustments. Do we do soft wave in the office? Yes, and we do it with adjustments. And every time we come in, we're going to check your spine, we're going to adjust your spine to make sure all of these 24 bones are in proper alignment with the ones above and below, with no pressure on the nervous system, so this whole body, this skin-covered meat sack of ours, works as good as it possibly can for as long as it possibly can. And we're going to do everything in our power to make sure that happens with the skill set we have and the therapies that we have provided to us so we can provide them to you. So if you know anyone that might apply to, give us a buzz, send them in our office. You can walk right through that door because we're ready to help you when you're ready to be your best, naturally, and damn sure including the adjustment right here at Aspire Chiropractic.